Good evening, everyone, and welcome to the Raw Approach. You know who I am. I'm Dr. Woods, and I welcome you into the house on today. Hey, we got a great show for you on tonight. Remember to like and share and like. Let's get this thing to moving. And then if you see the stars, hit them stars out there so that you are promoting those today. But nevertheless, we about to get this thing started. And also, once again, welcome to the Raw Approach in the house. We have a special guest in the house. We're going to be talking about massage therapy, and I'm going to let her come in and introduce herself. Her name is Brittney McElrath. What's going on, Brittney?
Hey, how are you?
I'm doing fine. How you doing this evening?
I'm doing good. I'm excited.
All right. That's what I want to hear. I know the audience want to hear that you're excited. Well, take this moment and introduce yourself and what you do.
So my name is Brittney McElrath. I'm a licensed massage therapist here in Clarksville, Tennessee, and I'm the owner of Body McAnix Massage Therapy.
All right. Well, let's dive on in it. I hear a lot about massage therapy and everything that goes with that. Can you tell us from your perspective, what is massage therapy?
So for me, massage therapy is a mixture of physical work and energy work. The physical work being the muscle manipulation, releasing knots and things of that nature. And the energy work being the fact that I've found that in my 4 years of massage, there's also always a mental aspect that goes along with it. Because I feel like muscle tension, muscle knots and things like that, they're an outward manifestation of something that has gone on the inside. And the mental part really focuses on, coming in with anxiety, maybe depression, maybe trauma.
You still there, Brittney? I think Brittney's Wi-Fi fell out on us, y'all. But nevertheless, we talk about massage therapy on today. Now, y'all know I don't know nothing about no massage therapy. I know how to stay in my lane, and that is not my lane. But we're going to check, see what's going on with Brittney, and then we're going to dive back in. So give us 1 second. You got
Okay.
you got to do something with that. We call it that Wi-Fi, that Wi-Fi.
I don't know what happened. It just, but where did I drop off?
Well, you were talking about the two things, massage therapy.
Okay, yeah, it being a physical and a mental thing. So that's why I try to create a safe space. That way, people that are coming in, maybe dealing with anxiety or depression or some type of trauma, they can come in and actually relax and just release the weight, of the world. Even people that come in with just a lot of responsibility. Sometimes you just need a quiet, safe space to relax, and I like to be that space.
Okay. Well, and before we go any further, because I've had people want to know how to get hold to you and all of that, how can they get hold to you? Where can they find you at?
So I'm on Facebook and Instagram under Body McAnix Massage Therapy. All my information is there: telephone number, website, email, all that can be accessed from my social medias.
So if they go onto your social media, just to make it clear, if they go onto your social media, are they going up under your name or are they going up under Body McAnix?
Honestly, either one, because my information, my booking website is also on my personal page as well.
Okay.
Mm-hmm.
Okay. Cool.
Yep,
All
yep.
right. And then I will ask you that at the end also.
Okay.
All right. Well, let's dive into what are benefits of massage therapy?
So some of the benefits, stress relief, better movement, especially for athletes. I do work with quite a bit of athletes. Um, Circulation for those who may have, a lot of people have fluid buildup on their lower legs or just fluid
Uh-huh.
buildup anywhere. Circulation, massage helps with that. We all know relaxation. If you coming in and just need to chill, massage is great for that. It helps move lymph flow because I know a lot of people have issues with getting their lymph to move. Injury prevention and recovery is a big one because I do work also with the chiropractor as well. Shout out to Tennessee Spine and Wellness. And from there, I get to experience a lot of different injuries and how I can assist with those. So that's opening up my world to different types of things. And then injury recovery. If you've had surgery of any sort, or you may have strained something like massage is good for that. And then, as I mentioned before, I work with a lot of athletes, mainly bodybuilders.
Mm-hmm.
So helping them gain better range of motion, being able to recruit more muscles, therefore grow your muscles. So those so many benefits. Like that was just a portion, to be totally honest.
Well, you said something about bodybuilding.
Mhm.
What type of lifting are you doing? Are you doing bodybuilding? I know you be doing something in that gym, be throwing the weights up.
I really enjoy working out and I love to challenge myself. So most people ask, like, do you do competitions? No, I truly just enjoy going to the gym and moving my body. I feel movement is such an honor and a privilege to have. So
So do people ask you to come and train them, or you just being your own little word over there?
they do all the time. I am getting recertified in personal training. I'm doing that more just to have more insight for massage, but I
Uh-huh.
may start training again too.
Okay, I see you. I see you. Ain't nothing wrong with that. Ain't nothing wrong with that. All right, so let's ask this right here. Um, what are the different types of massage therapy?
So there's several different types of massage. I'm gonna talk about the four that I do within my practice.
Okay.
So Swedish massage, that's the traditional massage. Most people think of like a relaxation massage. Um, then there's deep tissue. Deep tissue is just for people that have like just a deeper tension, and it's really all about like feeling as well. So there's a lot that like I'm in massage therapy, especially with deep tissue and even Swedish. I'm really trying to like feel and vibe with that person's energy to see like what's going on. Because people ask me all the time, like, "Oh, how did you know it hurt there?" Or I'll be like, "Hey, you need to relax. Like, like, are you tense right now? Hey, relax."
Right.
They'd be like, "Oh, I'm not tense," and then they'll relax. I'm like, "See, I knew you were tensing up." And then that just leads me to ask more questions. Was that spot sore? Was there a surgery here? That just being able to vibe with people really helps out a lot too, and I use that a lot when I do deep tissue work. And then there's therapeutic work. Massage work is pretty much somebody coming in and they're like, "Hey, my neck hurts or my lower back hurts." There's really no specific diagnosis as to why it's just hurting there, so that then I do just like a general overall. It's always custom in massage to massage above and below where someone says it's hurting. So I do that a lot more in therapeutic massage. And then I also do medical massage. Medical massage is a prescribed type of massage. So some type of like doctor, whether it be medical doctor, chiropractor, um psychiatrist or somebody, they'll prescribe. So they'll tell me, "Hey, this person's sciatic is giving them issues," or they may say, "Oh, it's more just like prescription or a specific spot." So just for an example, like one of the chiropractors I work with, they may be like, "Oh, they have they have like impingement in their C4 C5, and it's sending pain up their posterior scalene. Just from that information, I know exactly where to go and exactly where to do. So medical massage is a more specific and detailed, like I'm here to fix this specific problem. So those are the 4 types of massages that I do.
Okay. Well, let me go ahead and get this piece out, because when talking to you, you be so business minded, you be so focused on getting your information out, and I like you for that. But I'm gonna have to get you on this one now. Now there's no way I could have you on this show and not have you represent the Z5 at least one time.
Absolutely.
Blue 5 to you, Sarah. Blue 5 to you. Blue 5 to you. All right. Let me ask you this. Being that I know you are at like 3 different facilities or places.
Yes.
That you do massage. And I know when we are talking.
Say your screen froze and it's still there.
All right, Brittney. Sorry about that.
Oh no, you're good.
Let me ask you this: what do you do for a balance, a work-life balance for yourself?
I love the outdoors. First off, I do get my massages. Okay,
Okay.
I have to get those massages in. I am an outdoorsy person. I love going hiking, going camping. Let's see, I'm an artsy person. I love art, going to an art gallery or just going to paint art myself, or do some form of art. Yeah, I like to spend my time being creative or being outside mostly.
Well, and I take it that you have no problem with shutting down and cutting away.
Absolutely not. Like I set my schedule and
Okay.
I set my schedule, and one thing I've learned as a business owner is sticking to that schedule. Like it's okay to deviate every now and again, but most of the time I'm set within my schedule with how many clients I'm going to take a day, like my business hours, things like that. Like I found that really helpful to create that work-life balance.
That's what's up. I appreciate you sharing that. I know I seen on one of your posts a while back where you was talking about phone totally shut off for the weekend.
Oh yeah. I went camping for my birthday, and let me tell you, yeah, I had my phone on because my mama, she wouldn't. I was going out to the woods, so she wasn't gonna play that. But for the most part, I did not look at my phone unless I was like taking a picture or something. But that was about it.
Good. Sometimes we got to shut off and get ourselves away in order for us to have a level of mental health, a good level of mental health for ourselves.
Oh yeah.
I appreciate that. All right, let's dive back into this massage thing. Let's discuss luxury versus necessity.
So, with luxury versus necessity, because I feel like a lot of people treat massage like, it's something like that shouldn't be like a part of their daily life. And I can understand how it could seem like a luxury. But if you think about how much you put your body through within a day's time alone, just think about, like years of that, same work or different work. Maybe you're more active this point in time, less active, but our bodies do a lot for us. And we should look at massage more like a maintenance type thing. like, going to get your teeth clean, going to get your eyes checked, make sure you're eating right, going to the gym. Like, it's a necessity for life. One of the reasons being pain management. Massage therapy is great for pain management. Back pain, neck pain, sciatic, arthritis, plantar fasciitis. A lot of people deal with. Like, you don't have to live constantly, day by day, in pain. Massage can assist with that. Injury prevention or injury recovery. If you've ever had surgery or just any type of injury, massage is good for that. For helping break up scarred tissue, which is getting blood and nutrients back to that area, because the main job of our body is to protect itself. So it's going to do what it needs to do to protect itself, and it's also going to do what it can do, and should what it's designed to do to heal itself as well. You just, I see myself as a facilitator of healing. And then stress regulation. That's a huge one. A lot of people come in for. Massage can lower your cortisol, which is your stress hormone, and increase serotonin and dopamine, which are your happy hormones. So, who wouldn't want to come out feeling great, And then a big one is work-life balance. So a lot of people are sitting at their desk, hunched over, looking at a screen all day. We know those blue lights aren't good for our eyes.
Right.
Getting headaches and things of that nature. Massage is good for addressing all of those issues. So it's a necessity to me.
Okay. I feel you. All right. The last one that we have, let's talk a little deeper about. You talked about the power of touch.
Yes.
Break that down for us.
So I want to also be specific. The power of safe, healthy, therapeutic touch, because unfortunately, there are a lot of us out here who have unfortunately experienced a negative form of touch. So with massage therapy, I don't take that lightly. And when I'm creating this safe space, and I'm also creating an atmosphere for healing. So touch is really good for helping regulate your nervous system. So as I talked about, like, people come in with anxiety, depression, because there's two sides to massage. There's a physical side and there's a mental side. So, coming in with anxiety or some type of trauma, 9 times out of 10, we're going to have to release that trauma to release those knots as well, because they all work together. That trauma is connected to that knot. So being able to create a safe space and, having people trust me to work with them, to help them, relieve their stress or, muscle tension, is really an honor. And even in massage, in my massage sessions, we also do breath work as well. So breath work is really important as well as, taking a deep breath, inhale, exhale. That really calms your nervous system as well. So we doing everything we can do to make sure you come out there, feeling as good as possible.
That's what's up. Big Josh asks, how often should one get a massage?
So that really just depends on what you have going on physically and mentally. If you're stressed a lot, you may have to come in more frequently, like every 2 weeks versus once a month. People that, tend to also take self-care as a priority, they don't tend to have to come in as often. So they're already stretching. They're already, going to the gym. They're already taking time away from their phone and things like that. They don't have to come in as often because they're also, they're not that I don't want people to come in, but they're just not leaving their, stress relief and their tension just for when they hop on my table or whatnot. They're, trying to be proactive as well, because there are things you can do outside of massage, which makes our sessions a lot more productive once you come in. Because if I'm constantly releasing this same knot that's taking me about, 30 minutes because it just don't want to let go, it ain't gonna take that long. But, just because it don't want to let go, like, this time we could have been addressing something else, but, you still getting anxious, or you still, holding on to something that's keeping it not there.
That's what's up. And then the next thing that is asked, what is the intervals of the massage sessions?
So intervals as in like warm up?
The time limit.
Oh, okay. Because I do go through intervals in the session too. It's a
Okay.
gradual, process. But so I have 30 minutes, and this is all in office. I offer 30-minute, 60-minute, and 90-minute massages.
36 and 90. All right. Do you have anything else you want the audience to know about Brittney McElrath?
No, I'm just really passionate about massage. I know the healing power of touch and massage, so I just hope that people try it out, because I just feel once you get your first massage, you're gonna be hooked.
Okay. And then is there anything that you would like to ask me or ask anything of the audience?
No, because I was rather nervous.
All right. Once again, put out there your information on how they can make contact with you.
So you can either find me on social media under Brittney McElrath or Body McAnix Massage Therapy. My link to my all my information is there.
All right. Y'all heard it. She's in the house. Brittney McElrath. Y'all know I had to practice that name a couple of times because I'm not good with names. But once again, I want to thank you.
Thank you for having me.
Yeah, no problem. I want to thank you for coming on, sharing your expertise with everybody, and now they know how to get a hold of you. I've had a couple of people text me throughout the day, want to get more information about you and talking about they need their own massage and just it said it'd be very interesting. They was going to tune in to hear. So here we are. So, do you have any closing remarks for the audience?
No.
I know you like, man, you go ahead and close this thing so I can stop being nervous. All right. Well, we're going to let you go. Once again, thank you for joining in. To the audience, hey, we're going to do this again next week. Same time, same station. And always remember, small victories lead to greater success. I am Dr. Woods, and you have just been hit by the R.A.W approach. Peace out, everybody.